Check, check. Check one, check two, check, check.
Welcome to HealthFactorx, the underground health headquarters they hoped you would never find. But you did, and now it's on. Before we begin, this video is for educational and informational purposes only. We're not giving medical advice. We're not recommending anything. We're just asking questions because sometimes the questions are more revealing than the answers. Always talk to a health professional you trust before making any decisions. So let's dive in. What if a dog dewormer was never just for dogs? What if a cheap, widely available drug quietly held more healing potential than anything big pharma's ever sold you? Yet the moment people talk about it, it's labeled dangerous, fringe, or outright misinformation. We're talking about fenbendazole, a compound used to treat parasites in animals. It's been around for decades, safe, over the counter, found in pet stores with no prescription needed, no $30,000 price tag. And for some reason it's starting to make some people very uncomfortable. Let's rewind to the story of joetippens. Back in 2016, Joe was diagnosed with terminal small cell lung cancer. It had spread throughout his body. He was given 3 months to live, no options left. Then through a veterinarian friend, he heard about fenbendazole, a dog med. At that point, he had nothing to lose, so he started taking it, along with a few common supplements. A few months later, his scans were clear, gone. He shared his story online, openly, honestly, without claims or guarantees. But instead of the system saying, let's study this, they did the opposite. They ignored him, or worse, mocked him. But Joe's case was just the start. Since then, a growing number of people have begun self-experimenting, sharing underground testimonials, and swapping results in forums, support groups, and videos. Not in labs, not in hospitals, in the shadows, outside the system. And what has the response been from those in charge? Silence. Suppression. Sometimes even censorship. That should make you pause. Now let's address the go-to shutdown line. But it's for dogs. Yeah. And water is just for swimming, right? We drink it. We cook with it. We clean with it. One use doesn't cancel out the rest. Veterinary medicine has a long history of crossover with human treatment. In fact, many human medicines were tested first in animals. So why stop the conversation here? Just because something is labeled for pets doesn't mean it has no value for people. It probably just means it was never meant to reach us in the first place. Or worse, it was known and quietly kept out of sight. Fenbendazole is part of a medicine class called benzimidazoles. These meds disrupt microtubule formation in parasites, basically breaking their ability to grow or survive. Interestingly, cancer cells rely on microtubules too. Early lab research suggests fenbendazole may interfere with cancer cell division, block glucose uptake, and even trigger cell death in certain lines. To be clear, that's lab data, not clinical trials in humans. But still, doesn't that warrant attention? You think so? But when something can't be patented or profited from, it suddenly becomes uninteresting. Let's ask a hypothetical question. If fenbendazole cost $3,000 a dose and came in a glossy box with a 10-minute pharma commercial, do you think it would still be ignored? Of course not. They'd be fast-tracking breakthrough trials. But because it's cheap, unpatentable, and already widely available, it poses a different kind of threat. A threat to the system itself. And when people start self-experimenting and sharing results, the media response isn't curiosity, it's censorship. The scientific response is not research, it's silence. Now don't get it twisted, we're not claiming this is a cure. But we are saying the silence is suspicious. Especially when you compare it to how quickly brand new experimental pharmaceuticals get pushed into the spotlight with little to no long-term testing. One side effect, no problem. A dog med with decades of safety. Total meltdown. Come on, this isn't just about fenbendazole. It's about the bigger picture. It's about how healing is treated as a threat when it doesn't follow the money. It's about how public curiosity is met with panic, and it raises a question. If this method is so useless, then why are they so worried or scared of it? It doesn't make sense. We're not pushing anything here, and we're certainly not making promises. We're just saying that when you shine a light into the dark and people start scrambling to turn it off, then you might have found something worth seeing. And this is just the beginning. We've got videos coming soon. Deep diving into ivermectin, albendazole and other low-cost, off-patent compounds that have sparked similar reactions, public curiosity, underground success stories, and near-total silence from those in power. If asking questions makes us controversial, so be it. Because maybe the real threat isn't the disease. Maybe the real threat is the cure they can't control. Please make sure to give us a thumbs up if this hit home. You're locked into healthfactorx, the blueprint for underground health, and the antidote to mainstream medical madness. Stay tapped in, subscribe, and hit the notification bell so you don't miss our next uncensored health drop. Peace. This video is for educational and entertainment purposes only. It does not provide medical advice, diagnosis, or treatment, and should not be interpreted as such. Always consult with a qualified healthcare professional before making decisions about your health. We're not recommending or endorsing any medication or treatment, only encouraging open discussion and critical thinking. Viewer discretion is advised.